Cytology is an incredibly useful technique to employ in veterinary practice. It's quick, it's cheap, it's minimally invasive and causes no harm to the animal, and you can gain a lot of information very, very quickly. It's particularly helpful with skin lesions because the skin is easily accessible and it's very straightforward to obtain the cells and hairs and so on that you might be looking for. We use cytology in almost all of our cases. It's especially useful where we have seborrhea, ulcers, draining sinus tracts where we may be suspecting infection. We can usually identify inflammatory cells and microorganisms very, very easily from the collected material. We'll also use related techniques such as hair plucks, adhesive tape strips, skin scrapes in any itchy animals or any animals with alopecia or scaling where we suspect some sort of parasitic involvement or perhaps hair follicle disorder. And again, for enlarged lymph nodes and nodules and lumps and bumps within the skin, it's a very easy way to obtain some material. And while it's not always diagnostic, in many cases it can give you a very strong idea as to whether this is an inflammatory lesion, an infected lesion, or some sort of neoplastic lesion, and can give you a very good steer as to the type of neoplasia and how benign or malignant it may be. As a profession, we need to be exercising better, responsible antimicrobial use. And one of the key areas in this is to try as hard as we can to always ensure that there is an infection present before we start treatment with antibiotics. And one of the concerns with sending material away is that that can necessitate sometimes a quite considerable delay, perhaps over a weekend, before we get the diagnosis back. It's also additional cost to the client. By using cytology and matching the results of that to the clinical presentation, you can actually make a very quick in-house, in-practice diagnosis of an infection. And whilst it won't give you information about the antibacterial susceptibility, from the type of bacteria that are present and the type of lesion that are present, you can often make a very good guess, and where necessary, this enables you to start empirical antibiotic therapy immediately before the client leaves. And this can improve clinical outcome, it can improve the practice-client bond, it retains income within the practice, and it also speeds up the whole process of diagnosis.